First of all, I do want to thank all municipal leaders for the great work that you all do. Obviously, you have guided your communities through COVID and so many other challenges in today's world, and we value your partnership, and we look forward to the future. Light at the end of the tunnel. So we'll start with Dr. Markson, who will give a great update on COVID, both from the hospital perspective and the community perspective. And then my partner Joe Pinto and I will give you a nice update on not only the new hospital we're building, but all the activity going on at our region, what's been accomplished to date, and what the future holds for us. With that introduction, I'll turn over to Dr. Markson. Bill.
Thank you, John, and thank you for everyone for having me. For those of you who don't know me, my name is Dr. Bill Markson, and I'm proud to be here representing the network, St. Luke's Network, as a physician. Despite my mostly subtle New York twang, I have deep roots here. My father's textile business was based at his factory in Walnutport, and I've been coming here since childhood. I continue to take care of many of his aging employees from Paris Neckwear and Accessories. And, this just goes to show you I care deeply about the well-being of the people of Carbon County. I joined St. Luke's after 29 years in private practice, as I understood what they would bring and have brought to our region. And I'm happy to be part of that. Next slide, please. I'm just going to go over just a bit of an overview. We're going to talk about some of the knowns of COVID, the unknowns, what I'd like to call the F words, and we have lots of reasons for optimism. So this slide is quite interesting. It shows the overall coronavirus case count in the United States. If you look all the way to the left, it looks like such a tiny blip, but that's when this whole thing started. That was in April of last year. Why was it so small? Well, it was really quite localized. New York City was being really devastated, but most of the rest of the country was having trickle amount of cases. In our region, as we know, Monroe County was hard hit, and parts of Allentown and Easton and Bethlehem, but Carbon County really was pretty light. We all prepared for a surge, but not too much. In July and August, there was a big surge in the Southwest and in Florida. And then from November until only 2 weeks ago, there was a huge wave that really enveloped just about our whole country. Next slide. What are some of the statistics that are interesting or important? We've now surpassed 500,000 deaths in the United States, 23,600 in Pennsylvania, and by my last count, it was 146 in Carbon County. Life expectancy in 2020 declined in the United States for the first time in many years, and for the underserved or particularly difficult communities, the decline in life expectancy was really even greater. The good news is that there's a significant downward trend in cases and hospitalizations up over the last 2 weeks, and our case count is down over 40%, approaching 50%. A vaccine has been developed, which is really quite an amazing feat, and 12.7% of eligible residents in Pennsylvania have been given at least one dose, and that's similar in Carbon County. 75% of our healthcare workers have been vaccinated. That's quite a big deal. And we know that the healthcare networks are particularly proficient at this point in vaccinating, where I'm very proud of St. Luke's and the job that they've been doing, but other networks have done a good job as well. Our limiting step really is vaccines, vaccine supply, and that's way short of demand. This is just an illustration to show you what has happened within our network. You can see we had a lot of case counts in April. Again, those were concentrated in a few places, and then the summer felt terrific. It was nice weather. There wasn't too much COVID. And then in November, really shot up again until finally ebbing in the last few weeks. We had almost 280 patients in our network hospitals with coronavirus at one point, and now we're down to double digits, but below 70, which is quite a relief. So the vaccine, the rollout, 3.5 million people are now eligible in the 1A. There's been a lot of talk about what all of these phases represent. It reminds me a little bit of my daughter's dance competitions when they would get gold, high gold, or platinum. 1A and 1B, it sounds like they're right around the corner, but we have 3.5 million people who are eligible in 1A and a vaccine quantity that only fully vaccinates 1 million people. So that's quite a discrepancy. As a point of reference, as far as I understand, 1C would be when local and municipal government workers would be eligible, including water, treatment water, sewage, that type of thing. And when will we get to 1C? I don't really know. I don't think any of us do. What are some of the unknowns? Why are cases declining, and will there be another wave? The idea of waves of epidemics are unclear. Most of the modeling is based on the Spanish flu of 1918. And we know that there were 3 big waves spaced months apart in that Spanish flu. And yet there weren't any vaccines to account for those declines. I think the biggest problem is that the coronavirus, you're contagious for several days prior to becoming symptomatic. And if one person spreads it to 2 people without knowing, and those people spread it to 2 more, you can imagine how the case counts can double very quickly, and we have big surges. And in the same way, when things are really bad and everyone starts becoming super careful, and there's less than 1 person getting it for each 1 person who's had the coronavirus, there can be a rapid decline. To me, is the biggest explanation. I don't think that the vaccination, as we've given so far, is the explanation for our current decline, although it is the reason for the decline of our own healthcare workers, and their decline in case counts have really rapidly followed the vaccine and preceded the general decline. What will the effects of variants be? We don't really know. We think that they're more contagious and maybe people get more ill with them. Do those who have had COVID need to be vaccinated? There's certainly been no change in public policy at this point, but we have reason to think that their need for vaccination is less. Will we ever be better at vaccinating or better at supplying vaccines? I certainly hope so. My expectation is so, but we have to see that. Johnson & Johnson is going to be a great addition to our arsenal if it gets approved. Of course, we don't yet know the true effectiveness of it. There are many folks who are not as savvy at manipulating the appointment system and don't have technology and are harder to reach. But if there's a one-shot vaccine that doesn't need sophisticated refrigeration and can be brought to people, and folks won't need a second appointment to be made, that would be a big improvement in our current system. Will a booster be needed? You see about that in the news often. I think it's still too early to tell. Do we still need to wear masks if we've been vaccinated or we've had COVID? Public policy certainly would say that we do need to still wear them. I think human nature is that if you're around a group of people who've all been vaccinated or all have had COVID, you're going to let your guard down. And I think as long as the case counts stay lower, I can't imagine that not happening, but public policy is not ready for that yet. Should pregnant women or should children be vaccinated? we don't really think that pregnant women we think that the vaccine is safe for pregnant women, but it has not really been studied. There are ongoing studies about that, and most of our network employees who have been pregnant have chosen to be vaccinated and have not had any problem. Children, we know that kids don't in general get sick with COVID, but they can be spreaders. So that's a reason to vaccinate them. But again, the safety not yet clear, ongoing studies. Summer activities. I mean, finally the snow will leave us and we want to go to our municipal pool and enjoy each other's outdoor company. Will they be open? I wish I had the answer for that. Again, I think public policy is going to depend upon experience over the next few months. The F words. There's a lot of fear. There's a lot of fatigue from COVID. There's a lot of questions about fairness. As a physician, I have people coming into my office. Some have been vaccinated and they're still afraid to be out in public. Some are still wearing gloves, even though gloves don't seem to really have any utility. And then in the height of the pandemic, we saw plenty of people wearing the masks underneath their nose as if they're Superman and nothing happens to them. A lot of people letting their guard down just because of fatigue with all the regulations. And I think there's frustration with inconsistency in applying rules, both for our own movement and also for businesses and what applies to them. It's natural. But ultimately, I think right now we're in a relatively good place, and there's lots of reasons for optimism. Most people I talk to really do want to re-engage in the world, and they're also willing to do what it needs. They're willing to do whatever is necessary to be safe. Experience around the world is really in guiding us right now. In England, they did a very interesting study of healthcare workers from May until November, in which they tested their antibody status for a wide swath of workers. About 10% of those had been exposed to COVID and had mounted antibody, even though they didn't know it. They followed them with swab tests over the next 6 months, and it was very rare for anyone who had been exposed to COVID to swab positive again, and it was even more rare for anyone to be sick who had been positive. So that implies to me that there's a pretty good coverage and immunity from prior exposure, regardless of vaccine. Israel is a country the size of New Jersey and has about 9 million people, and everyone is required to be in one of 4 healthcare plans, and it's very digitized, shall we say. And their experience tracking 600,000 patients with the vaccine confirms everything we know already, or everything we thought we know from the emergency authorizations. That is that the vaccines that we have are extremely effective, and the adverse reaction to the vaccine is very rare. We know the supply is going to get better. We have from our federal government big orders, and I just read today that Sanofi, Aventis, and some others who don't have their own vaccine are going to get involved in coming up with supply. From what we read, 600 million doses, which would really account for everyone who is eligible and who would want a dose to be vaccinated, should be available by July-ish. We know the snow will eventually end, that spring will come. That is much more for sure than the rest of this information. And in sum, I think we're in a lull right now of the virus. I think we have some time to get everyone vaccinated, and I think that it's realistic for us to be optimistic. Thank you.
Thank you, Bill. So we can get into our update now on the activities of the St. Luke's Network, and then we're happy to respond to questions. So this is a beautiful picture, by the way. The top building is what our new hospital will look like when it opens over the next year. And the picture below is the existing St. Luke's Lehighton campus, which also has a very, very bright future. And we're happy to share that with you this evening. You know, our theme is that for too long, people of Carbon County needed to leave the region for higher end care, for advanced care in all directions, north, south, east, west. And it's an access to care issue, and it's a quality of care issue too, because quite often there were transportation barriers and other barriers to get to care, and it affects the health status of our county. So we do see more unmanaged diabetes than in other counties, more unmanaged heart disease. And St. Luke's made a very serious commitment several years ago that we would develop a nationally recognized model of excellence for rural healthcare delivery in Carbon County. And this means not just a new hospital, it means a very comprehensive network from primary care to behavioral health and everything else in between. So these are the elements of our vision. You know, the first bullet talks about national recognition for excellence and quality. And since St. Luke's took over Blue Mountain Hospital several years ago, there have been dramatic improvements in the quality profile. 2 years ago, this local hospital was a 2-star hospital from a Medicare Compare perspective, and now it's a 4-star heading to 5-star, which is the highest level of quality. And in patient experience, employee engagement, when we benchmark to the other thousands of hospitals in the country now, we're top 10%. So as we move to the new hospital, we're relocating an existing quality profile that is exceptional. The second bullet talks about a primary care and urgent care network, and this is the engine. This is the first point of contact to the healthcare system for most people. And St. Luke's now has close to 40 family physicians in dozens of sites all over the greater Carbon County area. And this is a unique commitment made by St. Luke's University Health Network. It's the only health system to make this kind of commitment in the county. And again, this is a major investment in terms of dollars. All told, over $100 million will be invested in the county to develop this comprehensive system. So access to primary care is key. That's where it starts, as is the walk-in centers for urgent care. And we approach several 100,000 visits a year now to these centers, including our emergency department. The third bullet is medical and surgical specialists in all areas. So we are recruiting aggressively dozens of new surgical and medical specialists. We'll have more detail on this in a later slide. But the vision is that they're based in this county. These are not physicians coming up from Allentown or Bethlehem and satelliting up here a couple hours a month. This will be a full-time presence that will be able to respond to all emergencies 24/7 in the new hospital that we are building. And then the next bullet is of course the new regional medical center. We'll say more about this. This is a hospital that will have in-house critical care specialists 24 hours a day, 7 days a week. So the highest acuity patients can be cared for in this high-level hospital on a beautiful campus, by the way, 108 acres just off the Turnpike exit in Franklin Township. And then, so we can be a source of talent for this county long-term, this will be a major teaching center. We'll have medical students training at this hospital, medical residents, advanced fellowships in cardiology and cancer and all specialties, and a nursing school satellite, St. Luke's Nursing School satellite. And as we train young people, hopefully they'll stay in the county and they'll be our farm team for a long-term growth of the network. And then the final bullet is coming back to the existing Lehighton campus. We envision Lehighton as being a national recognized center of excellence for both behavioral health and acute physical rehabilitation at this hospital. And Joe Pinto will be saying more about that in his presentation. But needless to say, we see a tremendous need for both behavioral health and addiction services in this county. I should add that the Penn Foundation, a nationally recognized center down in Bucks County in addiction care, is joining the St. Luke's network, and we're hoping to work with them long term to see what we can do in this county for both behavioral health and alcohol and drug treatment. So those are the elements of the network we're building, and we're well on our way. The next slide, please. And what's the theme? The theme is keeping care close to home. And this is not just a catchphrase. This is a quality issue. We want to break down the barriers to care that have existed in this county historically. And we want to make sure that we avoid chronic disease, but if it does hit, it's managed, and we keep people out of the acute phase of their chronic disease. And we're already on our way to accomplishing that. Next slide, please. And this is our vision of the region. So it certainly includes all of Carbon County, but we believe that patients will come in from the western portion of Monroe County, the eastern side of Schuylkill County, we think the southern tip of Luzerne County, and the northern portions of Northampton and Lehigh County. So we envision this region, this delivery system, serving 180,000 people, and that gives us the scale to do high-level services such as advanced heart care, advanced cancer center, advanced orthopedic services. And it also will give us the opportunity to create hundreds of new jobs in this county. So we'll reverse this trend of people leaving the county for care. And not only will people in the county stay close to home for care, residents of other counties, of contiguous counties, will come to our services for care, again, adding more jobs and services and economic development to Carbon County. Next slide, please. And this is a more focused slide. It shows where the new hospital is, the St. Luke's Carbon campus. That's where the regional medical center is under development, and it's ahead of schedule, by the way. And then to the left is the St. Luke's Lehighton campus. That's what will be our outstanding behavioral health center and physical rehabilitation center. And then we have two of our Care Nows. The one to the left is in Lehighton, and to the right, that's the Care Now in Palmerton. And we have medical mall concepts at both of those sites, and Mr. Pinto is going to say more about that. But this gives you a good sense of the heart of the regional network. What's not on this map, to the north, we're developing a similar medical mall concept in Jim Thorpe as well. And then again, as I mentioned earlier, there are dozens of primary care sites all over the county. Next slide, please. Now, Mr. Pinto, my partner, is going to take you through some of the exciting stuff that's already happened at the Lehighton campus and other development in Palmerton and elsewhere in the county. Joe?
Thank you, John. And again, thank you, everybody, for taking the time this evening. I get the really exciting and I'm honored to talk about some of the work that's already been done at our Lehighton campus and in the surrounding communities. And it starts here at our Lehighton campus. And we're so proud of the work that we've done. And we get to show it off in these pictures. As they say, a picture says 1,000 words. And, those of you who have been through the campus, you know what I'm saying. Those of you who haven't, it's beautiful. We've invested significantly in the infrastructure, both, not only in the floors and paint and ceilings and so forth, but also in the technology, in the infrastructure, in our people. And you can see all the improvements that we've made on the left of the screen there. But really, it's a transformed building and facility, not only from, as I said, facility-wise, but the capabilities that we have. And I'm going to get into more specifics in a second here. But as you can see, inside and out, just a really looks great, and the quality speaks for itself as well. Next slide. So it started in our ED. It's often the first front door to our hospital, and we made some significant improvements here very early on in our tenure. We added new physicians. We have a new medical director in Dr. Ahmed. We increased the size from 9 rooms to 14, as you can see there. We invested significantly in new equipment, the latest and greatest in technology, but also very important here from a quality perspective. We have, as John said, to keep folks close to home, we have a stroke center. So we are accredited We meet the stringent requirements to become a stroke center. We also have something called chest accreditation for cardiac events. And most recently now, we are working toward trauma accreditation that'll be available this summer. Again, all of those are extremely important when it comes to community care and keeping these patients close to home. So we're really proud of that, and it's just been a great journey for us all. Next slide, please. Talking specifically about technology, and this one, again, another really big source of pride for us and me personally, which I'll get to in a second, but interventional radiology. We invested again significantly in that middle picture there, which is called a C-arm. It's advanced imaging that allows our radiologists and others to do procedures that have never been done before in our region, quite frankly. These are folks that have had to leave the area for this care and are now being cared for right here at Lehighton. On the right is our women's imaging. You see, we've invested significantly in mammogram, the latest and greatest in 3D mammography services. But more importantly, we have what's called a traveling team. My wife is a breast cancer survivor, so this is near and dear to my heart. Many of you probably have had women in your lives that have been affected by breast cancer, so time is of the essence when it comes to diagnosing and treating. So we are able to right here in Carbon County at our hospital, we are able to have a screening, a mammogram on a Monday, and by Friday or even that same day, literally have a diagnostic mammogram, a diagnostic reading, and then a biopsy that same day by folks who are fellowship trained in that particular specialty. So when we say what makes St. Luke's unique, this is a prime example of that. And when we say keeping care close to home, another great, amazing service that not many people may know about, but we offer right there in Lehighton. Next slide, please. Our cancer center, we just opened this in October. Another great source of pride for us, exceeded all expectations. The community has responded, as they say, with their feet. And we just hit the ground running, and we have an incredible team. Led by Dr. Tamam Habib, who's our medical oncologist. In the picture there, he's the gentleman all the way to the left. But all of the services that come along with cancer care and infusion, as we have listed there, all the support, the advanced imaging, and the lab services, and as you can see, a beautiful space with great views and nice and natural sunlight. So it's been again a great source of pride for us to be able to open that as fast as we did. And the services are going very well. Next slide, please. So John had mentioned about Lehighton, what happens to our Lehighton campus. And although we are extremely excited about the new campus and there's a lot of buzz in the air, the Lehighton campus is still going to be a huge source of pride and service for us and for the community. As John mentioned, also, it's going to have behavioral health, of course. But also we'll have our summit, our skilled nursing unit. We'll also have host our acute rehab, and we'll be growing the behavioral health complement there, looking at dual diagnosis. These are folks that suffer from mental illness as well as substance abuse problems continue in our community, as well as bringing all the outpatient services together under one roof to create, as we call it, a one-stop shop for patients to make it easier to access care. And then our vision is to create the first of its kind in our region and certainly in our network, which will be a walk-in center. This is something that, as we talk to all the community members and local leaders, access to care is a barrier, especially in the mental health field. And having this walk-in center almost as like an urgent care, if you can think of it that way, for folks in crisis, we think will be just revolutionary for this type of care. Next slide, please. Palmerton, what a great success story as well. We keep talking about this medical mall concept. Building, we just opened up our second building in that space. It's a surgical specialty center. So we host both medical and surgical subspecialists in this space. It's right directly across from our primary care and our Care Now that have lab and radiology. But the unique thing I just want to hope that the folks understand here is, so what we've done is we put all of these specialists, and you could read them all there, from diabetes, weight management, vascular, GI, and so forth and so on, and OBGYN in the same space. So now more than ever, a patient can come in and see a vascular surgeon, but also may have diabetes. And those two doctors can speak to each other in the back and make referrals, talk about their patients. And it's just great care, great continuity of care, great integration. And it's just a unique thing that we have, that we've set up here in Palmerton. So it's not only do we have the specialists, but we have them collaborating on a daily basis. And then across the street will be the first of its kind, right there on Delaware Avenue, will be our Women's and Children's Center, where we'll have OBGYNs and pediatricians seeing patients in the same space as well. Lot of continuity there, and just the first of its kind in our network, where those functions, those teams are together, and a lot of great educational programs that we'll have in place there as well. And then, of course, down the road, we have Dr. Grob and our orthopedic team that's just doing a tremendous job and caring for the community. Next slide, please. And this is where I'm going to turn it back over to John to talk about all the wonderful specialists that we have going. Thanks, John.
So St. Luke's serves 9 counties in the greater Lehigh Valley area, and we are recruiting more physicians to Carbon County this year than any other county that St. Luke's serves. And this is actually a partial list of the new talent that we're bringing to this county. It's dozens of new providers. And I mentioned the primary care, 40 plus in the region now, but medical weight management, diabetes management, I won't go through all these. I'll give you 2 examples, though. It's not only the numbers, it's the type of people coming here. I think we have a great medical community here, and talent attracts talent. We just hired a new gastroenterologist. And this gentleman trained at Harvard, both undergraduate and graduate and fellowship, is on the faculty at Penn right now, teaching there. And we gave him the same presentation we're giving you this evening. And this is a gentleman, young guy, who has had, he's just had enough of academic medicine and city life. And he has accepted a position to join us in Carbon County in this specialty. And there seems to be a pipeline from Cambridge to Carbon County, because the surgical oncologist, young lady, also trained at Harvard, at a Harvard hospital, both her general surgery and her advanced fellowship in cancer surgery. She's joining us, same kind of presentation, just excited about being part of this growth plan, part of this community, and is coming on as a general surgeon that will also help us build a surgical cancer program, breast surgery, colorectal surgery, and she also does specialty surgery and parathyroid surgery. So you can see the list. It's not only the numbers, it's the quality of people that will be here locally. I'll just go back to the original theme. We want it to be rare to leave this county for healthcare for the long term. Next slide, please. This is probably a couple weeks old now. This is the status of the new hospital. If you haven't been to the site, it's spectacular. And this is built with the patient in mind. All the mechanical systems are hidden. It's all private rooms, and you'll see the rolling hills of beautiful Carbon County in every direction. And beyond this beautiful building, and there'll be other phases, trust me, because this is going to grow very quickly. But it also will have a health theme. We'll have some organic farming going on at this site, walking trails. We want this to be a destination not only of health care, but health and wellness for the region. So that is the current status of our new hospital. Next slide, please. And these are the essentials. It is a high level medical surgical hospital with in-house critical care coverage 24/7, rapid response of every medical and surgical specialty, and the latest technology in surgery and trauma, chest pain, stroke, cardiac care, vascular care. And this is the hub. But I'll remind you that while this is sort of the project that gets the most attention, we are building a comprehensive health network from primary care to high-level inpatient care to behavioral health. And we do think it will be a national model for rural healthcare delivery. It's going to get a lot of national attention. Very excited about it.